What were we talking about?
I think we should start off talking about majority of the population right now wants to become an aesthetic injector.
All right, let's just talk.
Yeah.
Mm-hmm.
All right, you can get it going.
All right, lots to talk about today. New episode. Let's start it off by talking about.
Well, welcome to Inside Out Med.
There's been it seems like every day there's more and more notoriety and um, exposure of all of these, and I mean, of course, there's doctors doing it too, but a lot of them are nurse practitioners. They're going on Instagram and they're talking about either adverse events like vascular occlusions that they've had, as though because they've had one, it's something to celebrate and talk about how they corrected it. And they get all this praise for announcing that they had a vascular occlusion and being so open and honest about it and what they're going to do to fix it, etc. And then there's also the ones that are like advising people how to inject and different injection techniques, different combinations of injectables, etc. I mean, they're all experts. They're all experts on everything, and it's a celebration of mediocrity at its finest. And it's getting ridiculous. All the experts on Instagram, whether they're peptide experts, injectable experts, it seems like the industry is just being flooded with nurse practitioners and PAs that basically no more than doctors at this point.
How do you feel about the regulation varying from state to state, but nurse practitioners practicing on their own?
I mean, I obviously don't think that's a good idea. I
Why?
mean, if it was as simple as just doing injectables and never having an adverse outcome, etc., then maybe that's okay. But there's a lot of unexpected things that happen, and there isn't the medical foundation there to deal with that. Even if it's just primary care or basic medicine, I mean, you go to an urgent care, 9 times out of 10, you're not going to get the correct diagnosis because they're not experienced. They have nurse practitioners and PAs with limited knowledge, limited experience. I mean, of course, there's exceptions out there where you have really good nurse practitioners, but a lot of them are new. They don't have a lot of exposure to a lot of different things that happen, a lot of medication interactions, a lot of patients that appear with complicated presentations. And I mean, you go to an urgent care and they tell you to go to the hospital. I don't know what the point of it is really. And then you have the nurse practitioners, and it's just like that. What is it? The Dunning-Kruger effect?
A good example is, right, a lot of our providers have been injecting for a long time.
Mm-hmm.
How many questions do you get a day? And there's obviously levels to it, right? Each office has a medical director, which oversees the practitioners, and then you come in from a different standpoint, right? As a
Yeah.
chief medical officer, as an owner, and they obviously feel very safe talking to you because the amount of experience you have. So, how many questions do you get asked on a daily basis?
I mean, some days just a couple, other days quite a few. And I mean, obviously it varies by injector experience. You have injectors that are extremely experienced. They've been doing this for well over 10 years and they don't have a lot of questions. But just when you're talking about cosmetic injectables, you just get a lot of questions that are surprisingly very basic. Um, and it's kind of disconcerting in a way, but I mean, I appreciate them reaching out so that they can feel comfortable injecting. But
Yeah,
I mean,
but to have that safety net, I think is very important. To be able
oh,
to cross
100%.
collaborate it, right?
Yeah.
To be able to reach out to someone on, that comes from a different standpoint and get their insight on whatever they're administering at that time. I think it's crucial to have that type of collaboration, even when the providers bounce off of each other and they still feel like that they need a secondary opinion on whatever they're administering or treating or prescribing. What I find a little concerning is that, there's so many people out there, whether it's from aesthetics or wellness, giving medical opinions without medical knowledge or without medical credentials, let's say, or
Hmm.
medical knowledge, right?
Yeah.
Maybe you have a good understanding of what's going on within your industry because you own the practice, etc. But they're full on giving opinions on what's recommended.
Yeah, and I think that's going to be something you see in any industry where you have someone with limited knowledge, and when you have a very small amount of knowledge and exposure to a particular field, you feel like you're an expert. And then the more knowledge you acquire, the less uncertain you feel because you're starting to realize you really don't know anything about it. And as you slowly develop more and more exposure to the field and study all the intricacies of the field over time, then you can slowly become more confident again and more of an expert in the field. But um, in most cases, as people become more knowledgeable and more expert in their particular field, they become more conscious of their limitations in the knowledge base that they have and are more reluctant to like provide absolute answers and present themselves as experts. So it's an interesting thing is an inverse relationship between experience and confidence, um, as in the terms of like providing opinions on a particular subject matter, like whether it's peptides or injectables. I mean, you have the least experience, the people with the least experience, the least competency, providing all these like guidelines and confident teaching points on social media when really they should just be happy to sit back and watch. But
Well,
that,
talk about that example you give the example of what happened in St. Pete the other day with that patient um, who thought she had a
oh, I mean,
certain
yeah,
occurrence,
this
right?
is a basic thing. Yeah, so
What was wrong and how you were able to
we
walk the
had
provider to through to correct it,
yeah,
right?
we
So,
had a patient present with unilateral brow ptosis. The provider contacted me and said this patient has eyelid ptosis and prescribed her eye drops. Then the patient became upset that the eye drops cost too much money, and at that moment, I got involved and I asked for a picture of the patient. After receiving the picture, it was clear that it was brow ptosis and not eyelid ptosis, and that eye drops would be the last thing you would do in that situation, and that she needed a Botox touch up to correct the brow drip on the one side of her face. Um, but I mean, this is a pretty basic thing. We're not talking. I mean, most injectors that are watching this will understand this is pretty commonplace that you'll see some level of brow ptosis when you're doing frontalis muscle injections. But for just the provider not to realize the difference between brow and eyelid ptosis is concerning. And
but it's a good teaching point. I mean, it is, and there's going to be a ton of practitioners out there that are, working for an establishment, and then the point of this is they don't have someone that they can reach out to um, get a definitive answer on, this is what I think it is, and someone and you being like this, that's not what it is. This is why it's not what it is, and this is how we're going to correct it, right? So the patient ends up being, very appreciative, and that everything's corrected, that everything's, completely complimentary, and that she's going to get what she paid for in the beginning, right? So
yeah,
that's the whole point of it is that, as a provider, you should have someone that you're able to reach out to so that um, if you're second guessing yourself, you can make sure that you're following the right path.
yeah,
And I feel like I feel like there's a lot of practices out there that are, and I'm sure there are a lot that are like that, but I am positive there are a lot that are not like that. And it's concerning, right? Because then you have a patient who spends all this money on a cosmetic procedure and feels like they look worse, and then it's not corrected appropriately.
And you see that a lot. I mean, whether it's dentists doing injectables or newer nurse practitioners or even doctors that recently switched into the area. And that brings up an important point that, I mean, although maybe a lot of people find the whole idea of cosmetic injections and wellness, etc., a very desirable field to be in, it's not for everybody. I mean, you should really have some natural skill in that area to begin with. You know, you should.
What do you mean by that?
Well, if you're going to be doing something cosmetic, for example, you should have at least good fine motor skills. You should have a good idea of proportions and space and what looks appropriate, what looks desirable from a human perception standpoint.
You know, out of all of that, though, I think, you know, the most important skill set is to be personal.
Well, of course, that's
I mean,
usually the
that's
case
gotta
in
be
any
yeah, but
front-facing position.
not necessarily though, because it's, you know, a doctor at a hospital would be at a front-facing position.
But it's very important for them to also have good
They're
bedside
not
manner.
though.
But
They're
it
not.
helps if they
No,
are.
yeah, but 10 out of 10 times I've been to a hospital, never once. So I think that's the most important skill set to have, just because you can grow off of that, right?
I think
You
as a
have to be able
medical
to relate
professional,
to your
yes.
patients.
As
You
a medical
do.
professional, yes. But the fundamental point is that you need to be competent in what you're doing and produce a
Yeah,
adequate
but that's in
outcome.
any job, though. You need to be confident in what you're doing, right?
But I mean, I think that's the most the most important foundational skill is like if you're getting into cosmetics, you have to have a background in
How
cosmetics,
do you
art,
get it, though?
proportions. You just have to have a natural aptitude for it.
You're not gonna though. You're not gonna have a foundation in cosmetics brand new into the industry.
No, I know, but that's what I mean. A lot of people don't belong in it. A lot of these people don't have a clue on how to decorate their homes, let
Yeah,
alone,
but
let alone.
yeah, but they can learn.
You can't really. There's some
You
things you can't
can,
learn.
you can, yeah, but that's
If this
different.
person, okay, I'll give you
You
an
mean by
example.
cosmetics like aesthetics or cosmetics like acquired taste?
You need a good conceptual background of proportions, of spatial relationships, of what a human perceptible outcome that looks desirable is. You have a lot of injectors over injecting the top lip, producing these cartoon-like
What
results.
about a patient who wants that though?
You know, the biggest thing I see is patients and you'll see this on social media. Like now, the big thing is, oh, dermal fillers are horrible, right? And because you have all these people walking around
Yeah, but
looking like
that's
freaks
yeah,
because of all these people that should not be injected in the first place.
yeah, but it's not just necessarily because of that. I don't
You have
think.
to you have to be able to turn a patient away that wants a ridiculous outcome.
Of course, but then the thing is if you look at the educational gap, everyone's like sculpture a biostimulator, right? Sculpture's been around for what, 15 years?
Yeah,
Yeah,
it's been
so
along at least probably 20 years.
20 years, right? So sculpture has been around for 20 years, but right now there's a huge kick on it just because of the potential wellness aspect of it.
I mean, it's perceived as a more natural.
Correct. Oh, and it's the same thing with Daxify, right? It's the first neuromodulator to be bonded with peptides. So it's like, why is it superior? Not just because, first of all, it doesn't last 6 months. I don't believe in that. It lasts
Some
longer.
patients might
It
get
lasts,
6 months out of
You'd
it.
last a month longer, right?
Yeah.
You could guarantee that.
I would say it lasts about 4 to 6 weeks
You
longer.
couldn't guarantee a 6 month.
No, you can't
You
guarantee
can't,
that.
no.
But you could say you're
Kicks in
probably going to
faster.
get 25, 30% more
Correct.
longevity than with the other
100%.
toxins.
But you know, there's this huge kick on wellness, right? People want to take care of themselves. It seems like it's becoming more and more the norm. However, the gap is understanding what's actually appropriate, right?
Mhm.
Like where you're sourcing your medication from, where you're sourcing your aesthetics from, because it could just be more harmful in the long run should it not be from an appropriate source. And you know what I mean by that is a weight loss program isn't one size fits all. A Botox procedure isn't one size fits all. And um, they're starting to treat the purchase of what should be prescribed as, purchasing groceries at a grocery store, right? Just picking what looks the best.
Hmm.
And that even goes for IV therapy, right? That's the same thing for IV therapy. You look at a basically a table of contents, right? Of what an IV is supposed to do based off of the nutrients that are in it. But how do you really know that that's what's going to work for you? Don't, unless you go through a workup and then they're like, this is what I recommend. Out of my experience, based off of my background, based off of everything that I see, this is what I recommend off of what you're describing to me. That's the way the flow is supposed to go, right? Everyone can start with something basic, right? You could get a, the bag saline for the hydration, and everyone's obsessed with B12 injections, which I know you hate, and but when you really get down into NAD plus and high dose vitamin C and glutathione and all these great nutritional components, it should really be, which is the way we do it. It should really be it should be recommended by a practicing provider
Yeah, I mean,
instead of just
it's
like
being
someone coming
treated
to your
like a
house.
storefront
It is.
at this. I mean, where the patient orders what they want and someone administers it. Now,
Like the
obviously,
hangover IV, right? I mean, here's the thing: the equation is, you go out, you get hammered, right? What makes you feel better?
fluids.
One, you need to get hydrated, right? So it doesn't, but they market it as a hangover IV, which is not legal. I don't know if that's legal. I know we can't do that because of the certification we obtained.
You
We
can't make
full on
false
can't do it.
claims.
And so it's really the bag of saline that
Yeah,
that's making them feel better, right?
yeah.
The fluids.
I mean, there could be some. You know, we used to call that a banana bag in the ER because of the B12 component would make the liquid turn yellow, and they call it a banana bag. But I mean, when you're intoxicated or coming withdrawing from alcohol intoxication, I mean, you might be a little bit uh, B vitamin deficient, and that's the reason I think we add like a B complex to the saline mixture. But I mean, by itself, is it a cure for a hangover? No, you can't say it's a cure. I mean,
Yeah,
you
but
could say
that's
it
like
might
the big.
help.
That's like the thing,
Yeah. Um,
It's the same philosophy with any other type of procedure or wellness program that we offer, right? It should be recommended versus just it flat out being purchased. And let's say, there's nothing wrong with purchasing something, right? You go in, you purchase something, um, you see one provider, and maybe another provider recommends something different, right? I mean, you should at least be allowed to swap it. Providers should use their best judgment to be like, this isn't the right thing for you. This is what I
of
recommend,
course,
right?
yeah.
I mean, that
There
should
should
be
always
common
be that.
practice.
I mean, unfortunately, online when you're ordering things through Hims and Hers or Row, whatever, the patient gets what they want. I mean, they sign up for semaglutide, they get semaglutide. I mean, there's very little oversight by the provider. I mean, in very few cases are they being steered towards an alternative therapy because of something they said. And if it is something they said, it's an algorithmic change through the multiple choice questionnaire, and they like exclude themselves from certain programs. But there's very little human oversight
And
on those types of
what
things.
can you do to end up? You could just create a different account and then go get it
Of course,
and answer the
and
question a
answer the
little bit
question the way you
differently.
want it. Yeah,
Yes, so
and
that's the problem, right? And an even bigger problem is all this shit on TikTok with peptides, and it's just coming in a lyophilized form, right? And this whole backwater craze. And here's the thing: all the stuff, everything that we offer is trackable, right? By lot number, by
hmm
that's specifically it. Not necessarily. It's basically a SKU number, in aesthetics and wellness medicine, so that if something were to occur, it can be specifically tracked to figure out what's going on. Was it, misuse, misdiagnosis, or is it a defective product? And if you order this stuff online, something happens, you're just gonna look at your shiny little label and be like, who am I gonna reach out to? Oh, I gotta go to the
well,
ER.
especially if it's from one of these
That's where it is from.
peptide companies that popped up. Anybody from with a Not even a high school diploma can open up a peptide company and then also all of a sudden become an expert on peptides.
Yeah, but here's the thing:
But
it's for there's a financial motive there, right? Because anyone can open up any company. But you know what's crazy is we were looking at it. You can't own a HVAC company without having your HVAC license,
yeah,
right? So it's like, you know,
like medicine is like one of the only fields where that's excluded.
and
Like,
you think it would be you think it would be the hardest, right?
yes,
You think you'd have to be a doctor to own a medical establishment, right?
you don't.
Or
Yeah,
if you have these separate skill sets where you're a nurse practitioner or a PA, you could operate within this scope, right? Which, you know, is there, but again, it varies state to state, and it's not federally regulated, right? Why? Which is another thing that we continue to talk about, but everyone online is selling peptides. Everyone online is selling peptides. And the educational gap is the
massive.
yeah, but the difference it's very simple. It's coming from a manufacturer or it's coming from a pharmacy.
Yeah,
And everyone's getting peptides from or majority of the population is getting peptides from a manufacturer, not a pharmacy. But what I find worse than that is then worse than the people on TikTok is established practices selling not for research peptides.
yes, and that's becoming a big
Established
deal.
medical
Yeah,
practitioners.
one of the biggest culprits is BioStation, and I'm not gonna like they're selling retatrutide. They're selling a lot of these FDA banned peptides. I mean, you legally really can't do it. They're going to say they
Yeah,
can
but
because they
this
found a
isn't saying
loophole.
that those
But
peptides are
but
bad,
the
right?
problem is
It's just not
they can't
sourced.
source it
Yes, it's
properly.
not
There's
sourced.
no way to source it legitimately. You
Mm-hmm.
got to source it in the black market. So imagine going to a
What do you
reputable
mean by
medical.
black market?
You're ordering from a manufacturer overseas,
Or it's a
or a
front.
middleman
Or it's
that's
a
ordering
front.
from
Correct. Yeah,
or a
it's a
middleman
front.
that's ordering from a manufacturer overseas. So
In
it's
Florida, for just to put this in Florida, you can't compound those peptides. That's what it comes down to. You just can't. It's illegal to compound those peptides in Florida, which mean it doesn't mean that they're bad. It just means that it's not it could be made in an unsafe environment because they've got a hearing or whatever is occurring in July, right? To see if these compounds can be compounded, but as of right now, they can't. They full on can't, which means that it's sourced from an inappropriate source. That's what it means, and then it's used for human use when it's supposed to be for research purposes
yeah,
only. You know,
yes.
because I would love to take BPC 157 and everything under the sun, but I'd like to source it from a reputable
But
pharmacy and then
let's get
have it
into that a
dosed
little
by a
bit.
practitioner.
I mean, if you go, first of all, there's been ridiculous claims being made about these peptides. Some of them based on almost no clinical evidence whatsoever.
Yeah, but here's the thing with that. People are posting their stories, their journeys. I mean, it's significant, right? I mean, you've got some people who have got life-changing results. We see it all the time with regular prescribed programs or safe prescribed programs, I should say, like tirzepatide, semaglutide, NAD, glutathione, vitamin C. When
But
people,
Jay, half the time, these so-called experts on peptides, they're just bodybuilders, and
yeah,
99% of their results are from anabolic steroids, not the peptides. So it's a total misrepresentation. You can't make claims about the efficacy and outcome of a peptide based on a case study involving one person.
yeah. I mean,
And so, like
basically a
for example,
trial.
BPC 157. I mean, the biggest studies done on that really showed no appreciable clinical evidence
Yeah,
for
but
outcomes in
do
humans.
you think that some of these peptides that they're evaluating, the FDA is evaluating, are beneficial or could be
Oh,
beneficial?
absolutely.
Yeah,
But there's so
but
many.
it should be prescribed
It
by a
should be
yes.
prescribed, and and you shouldn't be able to make outlandish claims. Like, of course, something can be helpful, but the way a lot of these peptides have been described as they're cures to all these different
Yeah, but let's
ailments, and they're
let's
going
do
to
something
change
real quick.
your
Hold on.
cellular
No,
makeup. And
let's do something real quick. You're a physician,
yeah,
right? So I'm gonna list off a couple things and give me one or two words of what it's gonna do, right? And this is what they're doing. NAD.
It's going to enhance mitochondrial function,
Okay,
increase
that's
ATP production.
vitamin C.
It's
I
it's
am
it's a strong antioxidant, increases immune function or enables an improvement in immune function.
biotin.
It's involved in keratin production, and it is also a strong antioxidant.
Right. So I've got, based off of those three, it seems like cognitive function in layman's terms. It seems like um, immunity support, and it seems like hair, skin, and nails.
Mm-hmm.
Right. Uh, Trizepatide or semaglutide.
A GLP-1.
Yeah. What is it gonna do?
So tirzepatide is a GLP-1 and a GIP
What is
agonist.
if someone's gonna prescribe it? What's the outcome that they're looking for?
They want to lose weight.
Exactly. Right.
But you could also take that for all its anti-inflammatory properties long term, right?
Correct. But and here's the thing though, the gap is that when these are prescribed or administered and administered, um, one, you have two ways of doing it. Like those plans that you came up with with whether a patient's doing high dose based off of a certain set of outcomes or
Mm-hmm.
something that's not high dose based off of their workup and their lab results and the diagnostic exams and all that sort of stuff. And then there's another way of obtaining this, and it's just buying it online and doing it yourself,
Mm-hmm.
right? You see, there's a huge difference there in my opinion. I think anyone that would be watching this could see that, right? You're being put through a series of evaluations to determine what's best for you versus just clicking add to cart. The outcome of the product or the
Mm-hmm.
prescription is going to be substantially different in every single data set. If we were to take the same two people and do add to cart versus a program, there's going to be a substantial difference in every single set of data.
Absolutely.
And patients should realize that, right? If you're purchasing it for a reason, if you're purchasing it online or whatever it may be, you're doing it for a reason, right? Because you're looking to acquire a result. You can acquire that result a lot faster, a lot safer, and it can be done a lot more effective if it's dosed properly.
And I just want to be clear. I mean, as far as growth hormone releasing peptides, I think that's what a lot of people refer to when they say peptides. There's so many things that are peptides, and we talked about this a little bit last time, but
Did we talk
pretty much
about
any chain of amino acids less than 50 will qualify as a peptide.
Yeah, but did we talk about someone we know, right? Was on a weight loss medication prescribed through a practitioner, a
Mm-hmm.
qualifying practitioner, nurse practitioner who's able to prescribe.
Mm-hmm.
And you
Under
should
but under a
see
doctor's supervision,
yeah,
which clearly there was none.
and you should see what it looked like. I mean, you saw it, but if the viewers could see what was actually prescribed, I mean, you should be arrested, right? I
I
mean,
mean,
it's
it's
just
clearly
flat out
illegal what's
illegal.
going on.
It's full on illegal.
They're acquiring medication and relabeling
But
them.
then it's like, how do you pay for it? And it's like,
And
how did you pay for it, right? Because you can't do merchant processor, and the ones that do, it's like super high risk, etc. And so it's like, how did you pay for it? And it's like, oh, Venmo, but we have to send it as like friends and family. And it's like, okay, let's tack evasion onto that as
so
well.
there's racketeering.
Yeah.
There's there's medical providers
Yeah,
that
but
are
they have to
providing
know that.
illegally sourced medication to
Mm-hmm.
patients. There are so many criminal activities going on right now. It's clearly criminal on many fronts.
Do you think they know it's criminal though? Do they think they're just gonna get away with it?
I mean, if you're a medical provider, 100% you must know you're doing something illegal. If you're one of these clown peptide guys that are bodybuilders or, starting their like Instagram channel, I think they may be dumb enough to think that this research use only loophole somehow gets them out of any criminal complaint, but it doesn't. It's
Yeah, so
nonsense.
let's say that you sell a peptide online, or you have a peptide organization or whatever it is, and an adverse reaction occurs. Well, what do? You just go to the hospital and you just like, do you sue them? Are they liable? Like, what's going on there?
I mean,
Like, what do you think would occur? Like, let's say someone just flat out. I mean, because I see some videos of people
this
in the
is no
hospital.
difference than dealing drugs, Jay. It's no different than like that woman that got arrested for providing ketamine to that Friends
Oh
actor.
yeah, yeah.
I think she's got 15 years in jail. This is literally no different. I mean, it's not
Yeah, but that I mean that's a little different. Ketamine, you're on a way
this
different.
stuff could literally contain anything.
Yeah, that's correct.
And
Mm-hmm.
and maybe some have reliable sources, some don't, but
No, I don't
and
think any
some
of
have
them.
a
How is it a
certificate of
reliable source?
authenticity
It's
that
never.
and we could get
But
that's a totally different topic, but the certificate of authenticity does not have anything to do with sterility, by the way, and people seem to miss that part. But yeah, it's illegal across the board, illegal. Eventually, there's going to be enough, and there have been
but
case studies where there's people that end up in the ICU.
I see a couple things, right? Where
Hmm.
like I was on TikTok, and majority of the time, again, it's some bodybuilder, uh, you know, recommending everything. But there are I have come across some outliers where it's a nurse practitioner or a PA who's been in the longevity field for quite some time, and they're being advocates for what's going on is wrong.
Yeah,
And it's like, I wish everyone would just, like the nurse practitioners, PAs, MDs, DOs, like everyone who's within this field, right? That you went to school for a long time to obtain your licensure, right? Why wouldn't you be the absolute biggest advocate for all of the shit that's
for
going on,
patient safety.
right?
Yeah, I mean, I'm surprised there's not more, restriction to it. I mean,
Not
a
even just
response to it.
restriction, just response.
Yeah,
Yes,
I
just
mean, it's
response.
it's it's like I guess everyone's just turning a blind eye to it, including the regulators, the Attorney General of Florida, for
Why do
example.
you think that I thought it was because of uh I thought it was because of finances. But what's your take on why they wouldn't just put an end to it? Be like, listen, you cannot sell research peptides. It's illegal. If you are selling research peptides and we catch you doing it, you could face this. Why wouldn't that just be put into effect?
I mean, just the fact that
No,
payment
what's your
processors
why?
won't touch it.
Why don't you think that though? Why don't you think it would just be put into effect? What's your reasoning? My reasoning is it's too expensive to reprimand that many people.
You could go after the biggest ones though, and it wouldn't cost that much, especially the medical providers that are doing it. I mean, they should be hit initially. I mean, especially the franchises, etc. And then, I mean, you could work your way down to all these clowns operating out of their basement that are massive peptide companies and print the labels on these vials and they print
You remember
basically
all
whatever.
that shit I went through for dispensing qualifications and stuff for the practitioners,
Hmm.
and like all the coding that those label companies had to go through, and the tamper evidence. Because you have patients that don't want to inject themselves, right? They're
Yeah.
nervous, they just don't want to, and 99% of those patients will just come into the office for administration of their injections. However, you still have a percent that's like, I don't want to inject and I don't have the time to come here every week. Right.
Hmm.
So it's like, how do you fulfill that? And it's like, okay. So I went on a spiral, and that, researching everything, looping in attorneys, and figuring out the best way to be like, okay, we can get it from a compounding pharmacy, right? We can have your prescriptions, but we can give you the pre-filled syringes to take home. And it's like, but how do you do that without breaking a compliance gap? Because same product, honestly, patient safety, in my opinion, would be higher because they can't screw up on pulling up the product and and um,
Injecting the wrong amount.
injecting the wrong amount. But there's a gap where it looks at like you could be dispensing illegal drugs, right? That's just what it is out of everything that I
Hmm.
read. So I reached out to these massive printing organizations, attorneys, all of our suppliers for like, how do I get a tamper child-proof, um, you know, case so that in case a child were to get it, so like it's child-proof. And over the course of a month, I found it. but it was very expensive. It was very time consuming. You had to involve legal to confirm my assessment was correct. But at the end of it, there were gorgeous labels. There was a safe place to, dispense, drop, whatever, and store. And there was a way to give it to a patient to take home um, safely in a childproof container.
Yeah.
But everyone in the world has came up with an operation overnight with the website to sell, etc., and they're not worried about a single repercussion in the like they sleep perfectly at night. You remember how crazy I was,
Oh
how
yeah,
insane
yeah.
I
I mean,
was.
if people knew
I
how
was
many
going
regulations
insane. I was
we have to
literally
jump
going
through,
insane. I mean, you got to talk. I mean,
we,
how many conversations do we have about that when I was literally going insane? You
I
know?
mean, there's hundreds of regulations, and 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 that these other people are just bypassing every single, not one or two, but hundreds of regulations, and it's insane that this Wild West kind of culture exists right now, and no one is getting reprimanded, even a cease and desist on it. Like it's insane.
What about
Forget
all
about going to
those?
jail like they should be.
What about all the pharmaceutical fridges and all that
It's
stuff that we
endless.
went
It's
through,
endless.
I
Yeah.
mean, it
Even the fridges we have I get have to be like pharmaceutical,
there
have meet pharmaceutical criteria. So
it's just it's just and what's sad though um is that I think majority of the population would be would not be in our corner. I think that they're on the side of it's okay to purchase the peptides on TikTok.
yeah, and it's sad because it's ridiculous. I mean, come on. I mean,
You can
they're basing that all around the certificate of authenticity. And I
what's sad is something super bad has to happen for a corrective action to occur, right? I mean, Jennifer's Law in Texas, right?
for IVs.
Yep, right. So a patient had to die for that to be put into effect. And how long did it take? It took a couple of years,
Hmm.
like for that to be actually put into effect. Um,
But if anybody has any doubt, all they have to do is if they're not sure, oh maybe this is legal, maybe this isn't legal. Look at the big companies, Hims and Hers, Row, etc. None of them
do it.
do it,
Yeah,
and
because
there's a
it's not.
reason for it.
Yeah, because
They
it's
don't. You
illegal.
don't.
They won't touch
They
it.
would jump over anything that'll
No,
make
but
the money,
the most
and they
important
won't get
thing,
into it.
yeah, but you know what they all have in common, and this is honestly what separates us. I'm just gonna flat out say it. What all of them have in common is they obtain something called a legit script certification. Every single one of them has a legit script certification. That is an incredible company, Legit Scripts. It is by far one of the best because they audit everything, right? And there's some people who can probably, get around it, answer indirectly, have a front, and then have something on the back end. But they they're they mean well. Legit Scripts means well. And so all of those companies obtain a Legit Script certification and they audit how you market, they audit what you're prescribing, how you're prescribing, what your workflows are, standard operating procedures, everything. However, what separates us is if you get something prescribed by someone who just does telehealth, your support is just going to be through telehealth. If you get something prescribed at Refresh, you can walk into a practice if something is going wrong.
And you can talk to a doctor within a few
Matter of
minutes.
seconds.
Yeah.
Yeah. I mean, like I'm going to bring it back to the aesthetic, the aesthetic thing we were dealing with in St. Pete. You know, the provider reached out to Chris, and then Chris put together the plan of action, but then the provider was nervous on how that patient was going to react administratively. Like, hey, I think it's going to be, it's
Hmm.
going to be a situation that we might have to deal with. And I was like, okay, I'll call the patient, no big deal, and I'll make it feel okay. And that's what I did. But then on top of that, I was like, hey, listen, I'm gonna merge you in with our CMO, Dr. Sanger, and he's gonna tell you why.
Hmm.
And then everything's perfect, right? Within minutes, same day, right? Same day. And that's what that's why I think malpractice exists. Malpractice exists because of negligence, right? If you have a patient that has concerns, address it right then and there. Why are you going to
Well,
wait?
it's two things.
Why
It
would
could
you
be
wait? No, but
negligence
why
or it
would
could
you
be
wait? What's the
improper
point?
follow-up.
What's the point of waiting?
No, that's the problem. There's no
Improper follow-up.
follow-up.
Improper follow-up directly correlates with negligence or a lack of intelligence within your scope.
Yes.
Those are the only two things that on why malpractice has to exist, right? And of course, there's going to be a percent of the population that tries to take advantage of any industry. There's nothing you can do about that. There's always going to be bad people out there. But if you're ethical and you are providing a therapy service, prescription product, whatever it may be, I mean, just handle the issues then, there, now. Like, why wait? I couldn't just, you don't have 2 seconds to pick up the phone. I mean, the phone call was a couple minutes.
Yeah.
It's not like some
Those are-
massive inconvenience, right? And here's the thing, when we have first acquired these practices, like a couple months ago, and started changing everything, there were so many patient complaints, like on behalf of what they received prior to the acquisition, like more than I've ever dealt with them in my life because of dissatisfaction or whatever it may be. And I've just watched it drastically decrease over the course of the past couple months. I mean, they're like, you got to care. You got to care about your patients. You got to care about your providers. It should be, you got to put the care back in healthcare.
Yeah. And now that it's moved online, that's becoming an even more difficult hurdle to qualify.
Well, I don't think, so like, let's talk about online for a second with telehealth, right?
Yeah.
You personally can appropriately diagnose with the proper work, like set of questions and blood work virtually, right?
Mm-hmm.
However, when it becomes a problem is that there's the telehealth workflow is not just a pre-qualification, it's a qualification where you can just answer a set of questions and purchase.
Exactly.
That's when I think telehealth is wrong, right? Versus answering a set of questions, providing, whether it's blood work for a specific program or, actually speaking with a qualifying prescriber and then getting the appropriate plan. I mean, truthfully, how many times do you have a patient that comes in seeking one thing based off of like how, maybe Allergan marketed it, how Revance marketed it, how, Candela marketed it, because they all market their own products and services, and then you put them on something completely different, right?
Yeah, it happens all the time.
Right? You're like, this is what's actually going to get you to your results.
Yeah.
I mean, it's quite insane. You'd think that you would just follow the, that's why we have the satisfaction guarantee, right? You go with the provider's opinion and we can't produce that outcome, then we're going to back it and get you to that outcome until we're going to get you there.
Yeah.
I don't really see anyone talk about that.
And I mean, there's actually a lot of really good longevity medications out there. I know when people focus on.
Oh, what about rapamycin?
Yeah, I was just going to get into that, like rapamycin and colchicine and methylene blue. I mean, they have to be used correctly. In some cases, there's a lot of drug interactions there. But I mean, they actually have good studies behind them.
Yeah, but when we were looking into that, right? What was the first thing that you said with methylene blue, for example, or even with rapamycin? The first thing that you said was the massive contraindication with it.
Yeah, with methylene blue is
Correct.
SSRIs, SNRIs, and
Yes.
MAO inhibitors.
How many people are going to know that, though? I had no idea what you were talking about when you said that, right? Until we broke down, had a conversation about it. And like, you have to put those protocols in place and teach the providers how to accurately prescribe it. But like, you knew it off the bat. Like, after you knew it right off the bat.
I mean, it's not complicated, but I mean, it's just something you have to. And like, if you're getting this stuff online, and you can get it online, I mean, they're going to obviously ask that question. But some people don't disclose everything about the medications they're on, and they don't realize how important it is uh, to answer
What
these
could be the
questions.
adverse outcome?
Yeah, exactly.
What if
Death.
death? Yeah.
Serotonin syndrome. But yeah, it's not great.
I
So
mean,
some people might just blow it off. Be like, oh, I'm taking Prozac, but I'm not going to mention that. And then you have this massive drug interaction. So there's all sorts of examples like that.
talk
And
about well, also you were like, listen, before prescribing this program, you've got to have an evaluation, a workup, and blood work, right? Because what were you looking for in the lab work that could be a
mhm.
contraindication?
So, I mean, with everyone, you want to make sure they have decent kidney and liver function, right? There's a lot of medications that are either toxic or hard on the liver. And if their liver is affected, it could increase or decrease the concentration of the particular medication in the blood. Or if there's an interaction between medications, it could also increase the concentration of one of the medications in the blood. So you're looking for those kinds of things. You're looking for their cell counts. You're looking for anything that kind of be an outlier that may suggest the patient has something else going on, whether it's acute or chronic. So and that's usually the exception. Most patients are healthy. Most patients are good candidates. But you always got to look for those outliers. Those like 1 in 100, 1 in 1,000.
Yeah, I mean, we talked about this in a previous episode, but I had a family friend who was, significantly overweight, coming in for uh, their weight loss program with one of the providers, and he had blood work that was all over the place, right?
Yeah,
And and I remember the provider talking to you about it, and your first thing was, what type of supplementation is he on? What supplements is he taking
yeah,
outside of here?
yeah.
Stop all of it and come back in a week.
Hmm.
Everything was back to normal.
Yeah,
And everything was completely back to normal, right? Because you have no idea what's actually in the products that you're taking.
yeah. I mean,
I mean,
just like the
it's just what.
supplement business is,
Yeah, but
is
how do you feel? How do
highly
you
unregulated
how do
as
you feel
well.
about the? I mean, now, I mean, what goes hand in hand is like you get your peptides off of TikTok or whatever online, and then you purchase a at home blood kit for your at home
So
lab results.
well, I mean, the one thing I don't get about those websites that are selling like this monthly blood testing,
Subscription, yeah.
yeah, is one, you don't need to check most of these labs monthly unless there's some kind of problem with your lab work and you need direct follow up. But a lot of these labs are the kind of labs you're going to check once a year. So you're just throwing your money down the tubes, anyways, by rechecking the same thing and expecting a different result. The other part is with these monitoring technologies that exist where you put something on their arm and you send in the sample. It can do a metabolic panel, so it has no way to assess your kidney and liver function, which is important in most programs and most medications that a patient's taking. You want to screen for problems with kidney and liver and electrolytes.
I
So
want to know if like something were to come back bad, like what would they do? Be like, go see your doctor? Like, what do they do? What do you think?
of course they're
So,
gonna kick the can, just like if you go to an urgent care and there's like anything out of an ordinary besides a upper respiratory infection, they're going to tell you to go to the hospital. They don't know how to handle anything, and it's the same with these practitioners.
well,
Like,
that was the same thing with uh, Ideal Image with Valcyclovir prescriptions.
mhm,
It was just like you gotta go see your primary before you can start treatment, right?
mhm. Scared.
Why is that? I mean, is there something that, that we don't know? I don't understand it. Like, if you're going to a practice, right, they should be able to effectively, pretty much, if you're coming and we're testing for a set of lab tests and it comes back horrible, like
You have to know what to do
they
with
should
it.
know how to
Yeah.
address it, right?
I mean, don't just tell them to follow up with their primary care. Give
They
them
should,
some insight into the results, what you
correct.
need to do, how you need to retest, and what type of physician to follow up with. So, I mean, there's a lot of variables to take into account. But yeah, that brings in another thing. Like, I mean, all these supplements and herbal supplements and stuff. Some of them are actually very unhealthy for you, and I mean, they're over the counter at any pharmacy or supplement store. And I mean, it's a fairly unregulated industry as well. So you'll see TV commercials also for all these things that are supposedly going to improve your cognitive function or boost your testosterone levels. It's all smoke and mirrors. It's all a gimmick, and I don't think it should be allowed, to be honest with you. But
It's what's great is that when a patient goes on a program and they feel better, right? But you end up running you do their follow-up blood work, and it actually shows that they're doing better, right?
mm-hmm.
That is an appropriate program. When not, because you have a placebo effect. Like there's so many. I mean, that's a known thing, right? To where you think it's working.
Especially if you're in an acute state of recovery, and that's what a lot of these peptides operate under that premise. Like, so you'll just have had surgery, or you'll be coming back and recovering from some kind of injury, etc., and you'll take TB 500, BPC 157, MOTS-C, etc., and you'll get better. But you would have probably got better anyways. So it's like, the body does recover on its own before peptides came along.
What's crazy is the biggest thing, right? The terminology that they give these peptides, like the Wolverine stack,
Mm-hmm.
the glow stack. I mean,
Very medical.
right?
It's gonna be a Superman stack coming out.
I mean, it's insane. It's just crazy.
I want the Wolverine blend. Do you have the Wolverine blend? I'm like, come on.
You got it. We get
We're
asked
not-
it all the time.
I know, it's crazy.
They're and we've got they're like, the patients want this. I'm like, listen, it's gotta be regulated.
I mean, it might be great, but we can't source it properly.
No.
I'm not going to take a chance with the patient from something that's sourced from China. I'm just not.
You know what's funny is that, and let's say we did. Let's say we took that chance, right?
Mhm.
Here's the thing. An adverse reaction occurs, it's our fault. Like, we're getting sued. We're fully liable. I mean, whatever convictions that could occur, whatever fines, damages, etc., you can fully seek all of that.
And it's criminal.
Yes.
On top of it all.
And it's criminal on top of it all. So I don't know how this scenario is any different for someone who's doing it on
I mean,
out of their
I get
basement.
Biostation. They got balls. I mean, they're anxious to make money, and obviously, I mean,
We've got hundreds of patients, thousands almost.
thousands of patients
asking for these sorts of stacks.
We will not do it.
You can't get it. You can't get it. I mean, you can't get it reputably. And because of that, you can't control if an adverse reaction were to occur, right? Because when you get one of these programs and you get a prescription, like I was saying with the lot numbers, I mean, that pharmacy's on the hook, right? Just like when Allergan sells you Botox or Revance sells you Daxxify, they're on the hook. It's not just the practice on the hook; it's also the supplier, the manufacturer. They're also on the hook, right? We have it all the time where like Henry Schein or McKesson, like if something happens with one of their products, syringes, sterility, they'll recall a whole batch. Right, because they're like, hey, we're recalling all of this because we found something that's abnormal. And we're recalling everything.
Yeah, and after they make a batch of any med,
these are massive companies recalling shit, like huge, right? And they're sending out massive recalls. Like, listen, we found one needle tip that was off, and in the thousands, possibly millions in this batch, we have to recall everything. I mean, you look at it with cars, right? I mean, they do the same thing with cars. Well, they'll have these huge recalls because something isn't up to standards. Why aren't they doing it with this?
They're not doing it with this because it's all under the radar.
But it's not.
But
It's
it's
so
not.
not.
Yeah.
It's,
I mean, they're just like fearless. They're so blatantly excited about doing something illegal. I've never seen it.
I mean, they're not for research purposes. I meant not for human use, for
Well,
research
then they
purposes only.
slap
It's
clinical use only or physician use only. I don't even know what kind of semantic games they're playing, but it's not for it's for research only,
so
research use only, and that was something that these foreign online pharmacies came up with years ago, and now all the TikTokers and the Instagram guys are doing it. So it's something that's been around for a while, but nobody was doing it because like who wants to buy something from outside the country that is making claims and they say on their website for animal use or research
But
use
what about
only.
the environment that the product is then put through, right? Because it's like,
Exactly. On its way to you,
yes, like the extreme temperatures and, I mean, it's
sitting on
on
a
a
boat,
cargo ship.
on a cargo ship,
It's,
yeah,
that's
at
ins-
100
I
degrees.
mean, like we get a prescription shipped to the clinic, or if it arrives to your house when it's I mean, it's still cold by the time it
And you know
arrives.
what some of these guys will say? Will say, but these compounding pharmacies don't really make it anyways, and they're going to get raw materials sourced from here and there and there. Okay, but if they do get their raw material from China or some, they still have to verify everything. They have to go through these rigid standard protocols. Once they create the compound, they have to do sterility protocols. They have to verify the potency of the medication, etc. The and
They're liable.
they're liable.
They're fully liable
There's no liability
for every
anywhere here
just
in
like
this
we're
scenario.
fully liable for every patient that we treat, right? And of course, these pharmacies have waivers and this and that and whatever. Same with, patients or someone going to a hospital, right? Just but one, ethics, right? If you own a company, you should be ethical, right? In all business practices. And then two is safety. I mean, safety and ethics, they go hand in hand. And when you're vetting your pharmacies, right? I mean, there's certain things to look out for. The main thing is it a legit script certified pharmacy, right? Because they put them through a whole bunch of audits and continuous audits on that basis. And then two is like you have pharmacies that have certain certifications for certain products, like beyond use dates, and then prescription use only versus office use only, like glutathione or vitamin C and all that sort of stuff. I mean, there's so many different variables that come into effect, and all of it's just being thrown down the drain, like every little bit of it.
And just to be clear, none of these peptide experts are experts at all. They're regurgitating sound bites that they've looked up on the internet through Chat GPT or whatever. You could summarize their entire knowledge in 2 or 3 pages of a short paragraph description on like 20 or so peptides. And they're just regurgitating a lot of scientific words that clearly they have no background. They don't know what they mean, a lot of them. Or they're regurgitating fancy words like, oh, I'm gonna change my cellular makeup, whatever the fuck that means. But I mean, there's all sorts of like silly things that they say, and they come across as sounding somewhat scientific. But these are people with very little scientific background, no medical background, no nothing.
But here's what I don't understand, and this is, I mean, the sole common denominator in all of this is financial motive, but you've got someone who dedicated their life to being a doctor, right? That's what you wanted to do. You wanted to become a doctor. You have someone who dedicated their life to dentistry. They wanted to become a dentist. Why are they coming into wellness, anti-aging, and aesthetics, right? Didn't you want to be a dentist?
Well, that's not it. Don't even
This
talk about the
is this and
chiropractors.
then a chiropractor coming? I mean, didn't you want to be a chiropractor?
Yeah, it's like I became a chiropractor because I couldn't become what I really wanted to be. So I just pretend to be a doctor. That's what's going on. And what
I
does that tell you? If that's not a big enough red flag, I don't know what is.
I mean, like, you could be a doctor of any type of profession, right? I mean, like, you could be a doctor of finance, a doctor of, yeah, physiology. Remember we were talking about that? What was it with the,
Pharmacy?
no, not doctor of pharmacy, but the fitness thing, health and fitness. That one doctor
Kinesiology or something?
yes, doctor of kinesiology. I mean, you could be a doctor of anything, right?
Yeah.
Um, but it's how you're referring, how it's perceived,
Yeah.
right?
And
Um,
and misusing this, and there's been some states where it's been illegal, like California, the misuse of the doctor terminology in a medical setting. It is fraud. It's fraudulent. Like if say you're a doctor of nursing and you're calling yourself a doctor to a patient, the patient's going to think you're an actual physician.
yeah.
And it's a misrepresentation, and it's a fraudulent misrepresentation.
You know what's one of the craziest things going on within our industry right now, outside of all of this, is that you'd think this would just correlate with, okay, they're sourcing it from China or whatever, but you've got real nurse practitioners, licensed, um,
And
with
and me- and
men
doctors.
and doctors, nurse practitioners, PAs, MDs, anyone who's credentialed to inject Botox, Dysport, Xeomin, Daxxify, whatever it may be, full on credentialed, and they're sourcing their product from overseas. That is fraud.
And you don't know where they're getting it from.
It is nothing other than financial motive and fraud. Right, you could, because the reason you're doing that, the reason you're not purchasing through Galderma, through Merz Aesthetics, through Allergan, or through Revance is financial motive.
Yes.
That's it. That's the sole purpose behind.
And
Not because you think the product is better or more superior. That's invalid. You can't make that claim. It's fully invalid. It's because of financial motive.
and at the same, so these are the people that are doing Botox parties, or operating out of their apartments, or some sleazy little med spa down the street that's doing $6 a unit Botox, which is impossible. Like if they're doing $6
Unless
a unit Botox, it's
year
impossible.
round, yes. But, so here's the thing. We try our hardest to acquire as many patients as we can to show you what it should be like, right? So you come in off of an introductory offer where we just lose money.
Mm-hmm.
We're not, it's just a full on loss.
Yes.
Just to show you what it should be like. But it's not sustainable, right? That's why you can only obtain one. But here's the thing. I mean, whether it's Botox, Dysport, Daxxify, Xeomin, they're all great products. I mean, you did my Xeomin a week ago.
Uh-huh.
I love Xeomin. Huge advocate for Xeomin. I can't feel the product. It freezes me right away. I think it's great. But, and that's what it comes down to, right? Listen to your provider. We guarantee our results. We have a satisfaction guarantee. So it's like, if you're not going to obtain what we're telling you you're going to obtain, again, it's on us. But it's fraud, that what people are doing. It's counterfeit. It's counterfeit for financial motive. Like, you should be thrown in jail.
Mm-hmm.
I mean, that's just flat out. It's misrepresentation. It's fraud. I mean, it's just it just should be. You should lose your license. You should. I mean, I don't. It's fraud, right? I mean, do you not know it's fraud, or like, what do you think it is?
I mean, in some of those cases, because they think it's coming from, the same factory. It's, Canada Botox is not called, Botox Cosmetic. It's just called Botox, and they may get it from Canada because Canada has it for less money, and maybe the exact same product, but it's not FDA approved for use in the States, even though it's the same product. Now, those are a little bit more benign examples. There's examples where there's literally counterfeit Botox, where it is made to look like and represent an actual box of Botox, and it's not. it's just a counterfeit product, and there's all sorts of examples like that.
You've
Um,
got this Korean stuff where people are just buying it online and injecting it themselves at
yeah,
home.
that's crazy.
And
But I mean,
they're just like,
hey, people can do whatever they want to themselves. I'm fine with that. If they want to do stupid shit like that, I mean, there's a lot worse things that people can do. They can overdose on drugs, etc. So I mean, unfortunately, you can't stop people from doing harmful things to themselves. But the fact that it's allowed, like that these social media websites are allowing the dissemination of these e-commerce platforms for selling illegal medications, etc. I mean, it's
yeah, but the merchant processors are profiting off of it, right?
well, a lot of them won't even touch it
Yeah,
anymore.
but a lot of them are, and they're just throwing their credit card fees through the roof, right? They're like, all right, well, we know this is high risk, so you're going to pay 20% type of thing. I mean, that's what it is.
And I would suspect that most of these companies, these online new peptide startups, they don't even accept credit cards. They probably just Venmo, Zelle, wire transfer, and
I mean,
and
and you know, it's like friends and family, which is just
yeah,
tax evasion, racketeering, everything
yeah,
else that you could tack on to that. You know, what it all comes down to is um, there's obviously an education gap, but where there shouldn't be an education gap is established companies
mhm,
and actual medical professionals. There should be no educational gap
you're
there,
right.
right? I mean, those are the people who should be held to the highest accountability.
They should, and even they are getting away with it. So I don't know what's going on.
A lot's going on, but guys, thanks
All right.
for tuning in to Inside Out Med. We'll see you next week.